Great. Thank you so much, Madam Chair. This is a very important hearing, and I think as we put COVID in the rearview mirror, we're certainly hoping we pivot to the mental health and addiction issues that have arisen coming out of COVID. In New Hampshire, we saw very early on the devastation of the mental health and addiction epidemic, even pre-COVID, while the COVID pandemic has certainly exacerbated the mental health and substance use disorder crisis. It did not originally create it. Our friends, families, and communities were struggling long before the global pandemic. And that's why way back in 2015, I founded the Bipartisan Heroin Task Force. Today, it's evolved into the Bipartisan Addiction and Mental Health Task Force to better reflect the scope of the epidemic and the co-occurring illness. The task force is now comprised of 145 members from both sides of the aisle, many of whom are on this committee working to bring an end to this crisis. And I want to thank you for your leadership as well. The most recent data shows that over 100,000 Americans lost their lives to overdose just in the past year, the highest number ever recorded over 12 months. And that number does not capture non-fatal overdoses, those who survive and continue to struggle with co-occurring mental health and substance use disorders. We must do better for our communities, for our friends, and I can say, like Ms. Dingell, for our families. We must do better for the children and young people across this country. This legislative hearing is a critical step to ensure that they get the support they need. I want to express my gratitude to the chair for including so many bills from our Bipartisan Addiction and Mental Health Task Force legislative agenda in today's hearing, and we appreciate working with committee staff as well. Our 2021 legislative agenda includes 67 bills, all bipartisan, Republicans and Democrats bringing together good ideas to help people across this country. Over 40 of these bills fall within this committee's jurisdiction, and we look forward to continuing to build on the long history of bipartisanship in this committee in addressing the addiction crisis. Just before the onset of COVID-19, I visited our women's prison in Concord, New Hampshire, where I learned that fully 100% of the women in the women's prison were survivors of either sexual assault and trauma, that was 75%, the remaining 25% from abuse and neglect in their childhood. The majority of the women also struggled with substance use disorder and needed medication-assisted treatment. And that's why I have introduced legislation called the Humane Correctional Healthcare Act to repeal the Medicaid inmate exclusion and allow justice-involved individuals to access mental health care and medication-assisted treatment for addiction during their incarceration. It's also why I joined my colleague, Congressman Hudson, to introduce the Kids Cares Act, included in today's hearing, to improve children's mental health in the justice system by ensuring that children will receive a mental health screening prior to release. Before I get to my questions, I want to clarify a colloquy that Representative Burgess had earlier. Dr. Delphin Rittman, it's my understanding that it's the Centers for Medicare and Medicaid Services that is responsible for overseeing the IMD exclusion. Isn't that correct?
Yes, Congresswoman, that's correct.
And so it's fair to say that questions about the IMD's exclusion would be better directed to CMS and not SAMHSA.
Yes, that's correct.
Great. And just to be clear, you were not expressing an official administration position on the IMD exclusion earlier in this hearing?
No, that's correct. So because the IMD does not fall under the purview of SAMHSA's work, that's really more,
right.
Yes.
So turning to, it'd be helpful to discuss how these high-risk periods, such as the reentry period for those released from the criminal justice system, can be particularly important in providing appropriate mental health and addiction care. How critical is the continuity of care for adolescents with mental health diagnoses?
Thank you for that question and for your leadership and support of behavioral health issues. So continuity of care, we know, is important. in terms of helping people to be able to have an ongoing trajectory of care and be connected as needed.
Gentlewoman's
Great. Well, my
has
time is
expired.
up, but thank you. I yield back.